Welcome to another episode of Plastic Surgery Uncensored. I'm your host, Dr. Roddy Raban, and I am super excited about today's episode because we're going to be talking about plastic surgery stigma. I love it because, as you all know, I like talking about things that people don't want to talk about. I like to talk about things that are a bit controversial, and I think it's a subject that is on everyone's mind constantly, given where we are in today's society, which is we've arguably made progress, arguably made regress. It's hard to say where we are, but we definitely have been talking about self-esteem and loving oneself. So the show would be useless if we didn't have the commentary of wonderful patients of mine, and I am blessed that I am going to have the show with Sarah, a patient of mine now. For how long have we known each other, Sarah?
Dr. Raban, we met in the early part of 2020. So, right in the heat of the virus.
Yes, right. So we've known each other for 2+ years, and through the experience of surgery, we've gotten to know each other very well. So welcome to the show, Sarah.
Thank you.
All right. Well, we are excited to have you. So as always, we like to do a quick introduction as to how you and I met and what you've had done. Let me preface this by stating, the subject matter today is stigma, plastic surgery stigma. So there are individuals, I happen to be one of them, that when I do things, I'm very open about them. Like you. Hey, you had your nose done? Oh my God. Oh yeah. Hell yeah. Look at this. This is amazing. My nose looked terrible before, but look at it now. And guess what? I paid for it and I got it when I want it. That's the kind of personality that I have. And then there are individuals who want no one to know. I don't want my photos out there. I don't want anyone to know, hey, did you do your nose? No, not at all. And it usually comes from the stigma associated with plastic surgery, as if it says something about you. Then there's a second stigma, which is a super stigma, which is you've gone too far, you've done too much, you're a plastic surgery junkie, you don't know where to draw the line, you're starting to look cat-like. And so we're going to kind of address both of them, but why you're such a wonderful, wonderful patient to have on is because you've done a bunch of stuff, and I guarantee you no one would have a clue because you look stunning. So let's talk about it. We met in June of 2020. So what did we do for you first?
Sure. So we went in and I was unhappy with how my current breast implants looked at the time.
Right.
And I also was having some trouble with my abdominal area, not just aesthetics. Yes, the skin was crepey, crinkly, stretch mark. I had a baby.
Right. You had a baby. Yeah, you had a baby in 2008. That's very important to know. Okay.
Yeah, that's super important. And even though I was really fit and thin and all those good things, I just didn't feel like I was at my full potential with my body. So we did a breast revision. We put in new implants and we did a lift. And then we did some liposuction and a tummy tuck.
So essentially in 2020, you came to me and we did a mommy makeover, something that I do, right. I don't know, 3-4 times a week, which is, hey, I'm in great shape. I eat well, I exercise, and I had a child. And despite everything that I'm doing, my body is just not cooperating to the extent that I like. My breasts, I've had an implant. I'd like to change them. It's been in a long time. They're starting to sag a little bit. My abdomen, I just can't get rid of the skin. I have a little bit of a bulge. I guess my muscles are pulled apart. And I got a little bit of fat that's stuck in my love handles. And unless I become anorexic, I can't get rid of it. And we have that all the time, and we've talked about that on many occasions. So you and I did a mommy makeover, and surgery went great. You did amazing. You looked gorgeous. You felt gorgeous. And you tell me how you felt after that surgery in terms of how it impacted your life.
So surgery, that's such a scary word. So coming out of it and the healing part and just how I looked, it was amazing. Right afterward, and then the first 6 months, I became a new person. I started to shine even more. I feel like my personality is very bright to begin with, but it was amplified. Clothes fit better immediately. I was able to leave the house in confidence, especially living by the beach. By the beach, you're not wearing a lot of clothes. And it was just interesting because I could sit up and my abs were tight. My breasts didn't feel like they were sagging against me. It was just like getting a new set on life and a new body. It's like I had myself before I had a baby.
And I know, and you're married, correct?
I am
Happily married, correct?
happily married.
Got it. And so one of the things about mommy makeovers that are very special is that it's a gift that gives. In other words, you get the benefit directly, and then your life partner indirectly is a beneficiary, not because of the obvious, oh, wow, your breasts are bigger, so he likes them. Not at all. It's because now you have this sort of shine to you, and that shine is that confidence. That confidence spills over into your interpersonal relationships. Again, you're special in that you're already a very confident woman. I've now gotten to know you quite some time, but there's this misinformation that in order to get plastic surgery, you have to be some super, I don't know, insecure, meek individual, and that plastic surgery just makes you confident. Not at all. You're super confident before. But I can't imagine that this didn't add a little oomph to your interpersonal relationship.
Oh, but it did. So yes, there is, sexually things are better. But just he saw me for who I was before I had a child. We met afterward, obviously. So it was like a way back in time. He saw me as a whole complete person in my eyes, which he saw me before as that. But he said just the look on my face every day of just waking up and being true to myself and not complaining that my mind doesn't match my body to that degree. It was life changing. And now we can go on trips. I can wear the bikini. I can wear the dresses. I can be expressed fully.
Okay, so then you did this. Awesome. Bye-bye. See you. I'll see you never. And what do you know? A year later, you came back and we did essentially the same thing we did for your body, except for your face. And we don't really have a coin for it. We don't have a cute name like Mommy Makeover. But we did a bunch of surgeries on your face, all of which is arguably incredibly subtle, yet the collective group of them is incredibly powerful. So I'm going to read off the list of things that we did. We did a nose job. We did a chinog. We did some liposuction of your neck. We added some fat in very select places, and we removed a little bit of the buccal fat inside your cheeks. So that's like theoretically 5 or 6 procedures. And so, oh my God, this poor girl, she must be so insecure. Oh my God, she's a plastic surgery addict. Oh my God, she must look like Catwoman now that she's done all these surgeries, right? Isn't that how the stigma thing begins? So Tell me about what triggered in your mind to have you circle back and do this secondary surgery?
Sure. So I started working in my current field of web design, branding, and I was on Zoom a lot, just like the rest of us during the pandemic, right? We're seeing ourselves on Zoom all the time for the first time. And I just had realized that there were some things that I feel like could be refined. I loved who I was. I just saw that, hey, you know what, maybe little refinements here. And I didn't know what they were. I was just like, something can be updated. That's what started that conversation, that internal dialogue with myself. And that's when I was like, you know what, Dr. Rabban changed my life with my body. I'm going to go see what he can do for my face. And so I came to you with just wanting a chin and a nose job. And then you had to educate me on it's the small refinements. You don't need a new face. It's just small things that can be tweaked that can bring out your best features.
Right. And so, and the reality is, and I keep reiterating this because I think it's really important to understand this, you don't have to be super insecure to get surgeries. You can actually be incredibly secure. You don't need to have very dramatic things done in order to have dramatic changes. They can be subtle things. And so as a result, now you've done a boatload of surgery, right? Mm-hmm. And if we don't mention it, you go live your life. No one has a clue. You look fantastic and you're happy. But now if you have this conversation, which we're doing purposely, we are exposing that you've had all these surgeries, because if we had this conversation and someone didn't know you, they would say all the things we said. So the stigma. And so what we want to talk about now is, why? Why is there's this shame associated with plastic surgery? What is this stigma? Where did it come from? And what do we do about it? So what do you think in your mind? What do you think where does this stigma come from? Because clearly you don't have it because, as I mentioned to you, I have the patients, a decent amount that are like, oh, please don't use my photos on social media. No problem. I get it. Oh, and I don't want anyone to know. And I always am curious because I'm just inquisitive that way. Are you ashamed of what you did? In other words, if someone probed you and said, "Hey, Sarah, did you do your nose?" Would you be the type of person that says, "No, I never did"? So I'm always curious. So what do you think? Where does the shame and sort of stigma come from in your mind?
In my mind, I think it comes from just the early ages of people seeing tabloids. I really think tabloids are a big derivative in bad images and plastic surgery because that's what they make money on, right? It's media. Media could be great and it could be bad. You probably know a friend down the street that she had some work done. It got a little excessive. I think it really has to do with who you talk to, and what doctors you go to, and lack of education, and just the stigma of really, I think it's the media, Dr. Raban.
Well, I think what ends up happening is, I mean, that's definitely for sure. I think the media has, I mean, as we all know, the media can make cocaine healthy. You know, it can make, you know, it can make stealing considered, an art form. I mean, it can do whatever it wants. And so obviously the media and tabloids are very a big part of it. I think there's a couple of components, as are the case with all things, right? It isn't singular. There's definitely a component of our current place we are in society, which is sort of the new wave of accept yourself, love yourself. Any version of yourself is good. The way God, you know, and it's, you know, you'll have both sides of the coin saying, well, no, if you're 574 pounds, it's not that we don't love you. It's not that you're not worthy. It's not that it's not okay. It's just terrible for your well-being. You're going to get a heart attack and drop dead. Your knees don't function. So since when did being obese be okay? Well, in our society today, there are lots of people who think that if you tell someone that they're fat, overweight, excess weight, whatever term you want to use that's not considered PC or PC, that you're fat shaming. And obviously I'm referring to things done in a way that isn't nasty or harmful, but just stating the facts. So now the idea that you want to go and change yourself is considered bad. Like, why don't you just, Sarah, why don't you just love your old nose? You don't love yourself. Well, says whom? So that's one huge component of today's society. This idea that you have to just accept things the way they are, and that means it equates to self-acceptance and love, whatever. I think tabloids have a lot to do with it. I also think shitty results have a lot to do with it, right? As you had said. So it's very funny because, you know, I always, you know, the people who are in anti-plastic surgery will always say, well, everyone looks so fake, you know, and the answer is, no, they don't. So let's take this analogy. You walk into a party, a Hollywood party, and you walk around with your friends and you're like, oh my God, look at those three women. Wow, they look so done, so overdone. And then you go home and you say to yourself, God, plastic surgery is just terrible. Look at all these people that look so done. When all the while you're thinking to yourself, the three women that had plastic surgery were overdone. But the reality is that 45 women had plastic surgery that night. You only picked up on the three that looked like shit. 42 of them were exceptionally done, subtle, tasteful, enhancing. So your denominator from which you're calculating is 3 out of 3, which means 100% of people who had plastic surgery did look bad because it's selection bias. Your assessment is biased on who you're selecting. If I had told you that there was 45 women that had plastic surgery, 3 of them looked crappy, 42 of them were spectacular, then all of a sudden would be 3 out of 45. Not so bad. That's 8%. So obviously bad results are obvious, whether it's on the media or the girl you know next door or whoever, and good results should be subtle and go under the radar. So I do think terrible results, pushing the envelope, has really done us damage. And I definitely think the stigma is worse now, I think, in a weird way than before. Why do you think that some people look terrible? Like, if you look at, like, you had all these things done to your face, right? And we're both biased because it's your face and I did it. So we both think you look amazing. But we hope somebody else would look at you and be like, wow, she looks good. So why do you think somebody else looks not good and obviously bad?
My take on that is people look bad because you don't consider the whole canvas, or you only work on one part of it. You don't get a second opinion or get education on what is out there and available to you. I think also when you see the older generation that got plastic surgery 20 years ago and you see how those are aging, that too. I think it's just so interesting to me, Dr. Raban, that when I do see someone that has something bad, it's usually one big thing, like a collapsed nose, lip fillers, that the girl's drooling at the cafe down the street,
Yeah, I mean, to me, plastic surgery, this is how I encompass it. I don't think this is a past generation, new generation. So past generation were shitty facelifts, new generation are duck lips. I mean, every generation will find the trend. The 90s were big boobs on, cocaine addicted models. I mean, every generation has their bad, overly done item, right? So To me, what makes bad outcomes is, first of all, you can't have a bad outcome unless you have a bad surgeon. Because someone did the work. Like, you didn't just walk in and it just happened. Someone operated on you. So that someone is your surgeon. So bad plastic surgery is because of a bad plastic surgeon. And we know we've done this many times. Many of the people that are doing it are not plastic surgeons. So let's begin by that. It's just people doing cosmetic surgery. So we won't dive into that. So there are two parts to a great outcome: technique and artistry. That's what makes an outcome. The technique, I'm going to do this type of rhinoplasty versus that type of rhinoplasty. For example, noses, I do structural rhinoplasty. A lot of surgeons do reductive rhinoplasty. Structural rhinoplasty is something where we add support. Noses tend to look good over years. Reductive rhinoplasty is taking things out and things tend to collapse. So there's the technique. I picked, in my opinion, the right technique. AKA, I picked the right recipe. Then there is the craftsmanship, the artistry, the practice element, the eye. Who says that your nose should be this rotated versus that rotated? And for those of you looking at how much of it do you do? And that's the eye of the person doing it. I want your nose tiny. I want your nose semi-tiny. So there is a vision of that person, just like the person doing your haircut, just like the person doing your interior design, just like there's a taste. That's a factor of that person's reference. So there's the technique, which in some instances has gotten better over the years, but in many instances haven't changed in decades. And then there's the preference or the taste or the skill set or the artistry. And it's really a hybrid of both. So good surgeons pick good techniques and execute them well. And those that don't ruin the results. And then people walk around and see those results and think everyone looks like that. So we're going to take a quick break and then we'll come back. We're going to chat a little about the stigma as it applies to body dysmorphia, because I think those individuals who've taken it over the top also contribute a lot to the stigma. And we'll talk about some other elements of empowerment. How's that sound, Sarah?
That sounds fabulous.
Plan it is. All right, we're going to take a quick break. We'll be right back with Plastic Surgery Uncensored. Welcome back to the second half of Plastic Surgery Uncensored. We're diving deep into plastic surgery stigma here with Sarah, my wonderful patient. So, Sarah, as we were thinking about stigma, how did it get this? How does this heaviness associated with plastic surgery occurred? And as I told you, I think it's the extremes that create the essence, right? The extreme plastic surgery, the terrible surgeons. And a lot of the extreme surgeries occur in an area of body dysmorphia, which is a real bona fide entity, which is an individual who literally looks in the mirror and doesn't see the reality that you and I see. So, for example, I look in the mirror and I think, oh my God, my neck skin is down to here. In reality, it's not. So I would go in and be like, oh my God, doctor, you got to fix my neck. So it's a break from reality. And so body dysmorphic patients or people who are on the spectrum, for example, I'm gluten sensitive. I'm not gluten allergic, but everything is a spectrum. And dysmorphia is a spectrum. You don't have to be full-blown body dysmorphic to look in the mirror and kind of not see what everybody else is seeing. So those patients then end up having a lot of surgery that is unnecessary, right?
Yes.
When you have a bunch of surgery that's unnecessary, you get shitty outcomes, right? If your nose is pretty damn good and someone operates on it, what's the chances it's going to be better? Not really. It's probably going to look like a little tiny little pencil, right? If you don't really have any loose skin in your face and you get a facelift, you're going to look like you just come out of a wind tunnel. So body dysmorphic patients, people who push the envelope on what they need, end up looking odd because they didn't ever need the procedures. And then as they walk through life, they then are billboards for plastic surgery. And as the billboard occurs, the lay person looks at these individuals and these individual results and says, oh my God, plastic surgery's gotten so bad. It wasn't this bad before. My God, this woman looks terrible. Or, oh my God, look at him. And so in their mind, this selection bias is occurring, when all the while it's unarguable that plastic surgery over the decades as a whole is much better. We're overall much better, but we're making equally many bad results. And those bad results are floating around. So again, the 42 women out of the 45 concept. And I think, again, who's to blame? I think at the end of the day, it's the surgeons, because, the gatekeepers of plastic surgery and the kind of people's thought process of plastic surgery and plastic surgeons are the surgeons themselves, right? Mm-hmm. Like you came to me and you said, hey, I want to do a facelift, hypothetically. I'm not saying you did, right? Right. Who's the one who makes the ultimate call?
Yeah, it's going to be the patient, I think, wants to get educated on it. But the doctor's going to, if you gave me a facelift, that would be totally whack.
Right. No. So you said, so it's not the patient. The patient is irrelevant. The patient cannot operate on themselves. The patient can demand it. The patient can pay for it. The patient can keep searching. Unless someone provides them that service, they cannot harm themselves from plastic surgery. Someone has to harm them. That's the goddamn problem. So I think the stigma came about because so many people are getting such shitty outcomes. You come to me and your lips are the size of, I don't know, a baboon. And you say, hey, Dr. Raban, I think I need another syringe of filler. I'm the asshole who injected you with another syringe that made you look worse than you did before you came in, who then you're out in public giving plastic surgery a bad name. So I ultimately always put the onus always on practitioners. I don't even like to use the word plastic surgeon anymore because sadly, it's not even plastic surgeon. It's the pediatrician, the ER doctor, whoever the hell is injecting, doing, cutting. It's the provider of that stuff. So I want to just talk about, the last thing I want to talk about is, as a patient who's had, I'm going to count them now, 1, 2, 3, 4, 5, 6, 7, 8, 9 procedures, right?
Yep.
Holy crap, what the as a patient who's had 9 procedures, when you interact with society, your friends, people, whatever, because you've been very forthright, you're a forthright individual. I mean, you're on the damn show. You're actually the one who even suggested this topic. How do you process this? Because what I want other people to understand is if you have your nose done, just your nose, I feel like you should own it and be excited about it because you did it and there's no shame associated with it. But somehow a lot of people struggle with that. So how do you interact with society having done these procedures and be excited about it?
Absolutely. I don't go walking down the street and I'm saying, hey, look at all this work I got done. Look at me.
Sure.
What? But I do have a lot of women that ask me what skincare I use, who does my hair, how do I look so refreshed and relaxed? What's the secret? And I'm always just laughing. I'm like, let me tell you something, doll. I got this many procedures done in this amount of time. And I tell them all about it. They're half the time it's either, oh my gosh, wow, good for you. The other time is you're very young. Why would you do that? So I just had to learn to manage it and manage it in a healthy way that it's not judgy. I educate them and I just let them know I was whole before. Now I can be at my true and fullest expressed self. And a lot of it, like just past weekend, I was talking to a woman and I told her everything. And she was inspired to have work done for herself because she had burns on her face and she wanted to get her nostrils fixed. And it was
Let me ask you a question. Let me ask you a question. Let's hyper focus on the naysayers. The positive people are amazing. Oh my God, I had this done. Good for you. Wow. Oh my God, I'm so jealous. I don't have the balls to do that, but I wish I could. We don't want to talk about those people because they're wonderful. I love them. We want to talk about the people like, oh my God, Sarah, you look amazing. You're like, hell yeah, I had X, Y, and Z done. And then they're like, oh, we're so young. What a shit. I want to know what you, aside from in one ear, out the other, which is fine. What do you say? How do you manage it? What do you say to yourself? Take me through that journey in your mind, because ultimately that's what frightens people from being open, right? Is being judged. I don't want to tell anyone I did my nose because I'm going to be judged. And if I told you that everyone would judge you positively, then you'd be like, okay, cool. But you never know what the response is going to be. And so for a lot of people, they rather not mention it because they don't want to they don't know how they're going to manage a negative response. So what do you do?
Sure. So how I manage a negative response, I'm talking to this person, I tell them and they're like, oh, no, you're too young. This is terrible. Why would you do that to your body? You must hate yourself. Well, I changed the narrative a little bit. I'm like, I love myself, and that's why I did that for myself. It is all out of pure love, and it's unfortunate that you feel that way, but this is what I've done for myself, and for my career, my life is now elevated, and I leave them at peace. And then if they would like to continue the conversation, I help educate them that little things here and there help. I do not look like a cat lady, but that goes to a defensive mode. Right. It's like, I don't ever want to defend it, but I definitely love educating people when they do have judgment.
Right. So I think you hit two things on the head, which I always say. Number one, actually three things. Number one, you got to own it. That's what I believe. I believe that if you do something, you own it or don't do it. Right. There's no shame in what you did. You got married, you got divorced, you own it. Whatever happens to you in life, you own it. Because when you own it, you set it free. When you don't own it, then you have to package it, compartmentalize it, hide it, and keep it hidden. Whereas if you own it, it's free and it's done and it's gone. Number one. Number two, you talked about the fact that you changed the narrative. So the narrative for the naysayer and the stigma driver, the person driving the stigma, is, what a shame, poor girl. Oh my God, you must not have been complete and you felt that you needed to pay to be complete or alter yourself. And the reality is, oh, no. Please. You don't know me, but I am was I complete? I was very complete. All I did, as I used the analogies, I was the most gorgeous diamond you've ever seen. I just polished it. I didn't change a diamond. There's no change in cut, clarity, color, or carat. I just polished the diamond. So I like the idea of changing the narrative, which is often from, oh, poor girl, to, what are you talking about? No, man, I love myself more than you love yourself. The second, and the way I go about things, is education. Oh my God, you had all those procedures? Oh, no, it's not all those procedures. I had my nose and chin done. I took a tiny amount of fat out of my cheek because I was a little round cheeky. I added a little fat along my jaw because I was born with a little weak jaw. I had already had a breast implant. And all of a sudden it's like, oh, right. So I do think through education and through positive dialogue conversion, I think those are very good ways to own what you do. Do you owe it to anyone? No, you don't owe it to anybody. And you don't need to go around convincing the world. But when the conversation comes up, and this is what I'm referring to, you either turn into the wind and you address the conversation, or you just bury the conversation. That's what I'm referring to. And personally, and like you, I tend to be someone who owns stuff, and I don't actually mind having the dialogue. I don't mind it. It doesn't bother me. I'm more than happy to explain to you what my thought process was if you're interested in hearing.
Yeah, absolutely. Right on. That's my approach in life. I'm definitely extroverted, and I just love educating people and chatting about it. And I just want to destigmatize it. I want everyone to feel just as good as I do.
Well, yeah. And I mean, listen, this was the topic that you suggested. You talked about the idea of stigma, and who better to destigmatize it than a young girl who utilized the tools that are available to her in life to empower. That's right. I'm using the word empower yourself to a higher quality of life, which then spins off to success and joy and love and intimacy and sex and all the things that everyone is hoping and striving for. You use the tools that are available. So bravo. Okay. Well, there you have it. Plastic surgery stigma 101. As always, thank you so much for Sarah for joining us. I feel like the episodes tend to always be better when we have someone to have a conversation with. And we're grateful that you are a courageous person who got on the show, and hopefully people found some benefit from hearing our dialogue. As always, if you enjoy the show, first and foremost, jot us a comment. If you don't enjoy the show, don't write anything. Just stop listening. And share, subscribe, download, give this to your friends and family. You never know who's going to want to have plastic surgery, and we're going to keep them out of trouble. All right. Until next time, I'm your host, Dr. Roddy Raban.